Aging population, what can be done about it? Joining us here to talk about this issue is Frances Norwood. She works at the U.S. Centers for Medicare and Medicaid Services. She is also an anthropology professor at George Washington University here in Washington, D.C. Thank you so much for joining us.
Thank you for having me. I appreciate it.
We've heard about this global issue. So what do you think needs to be done and what needs to be implemented in terms of social safety nets for this growing aging population around the world?
Yeah, it's a problem that around the world we are all facing, that people are aging and they're living longer with chronic illness for a longer period of time. I think the number one thing that we all need is better options for long-term care. We need to know that to be able to save enough money at the end of life, it's hard to figure out when you retire, how much you're going to need. And the myth that the government in the U.S., in any case, can take care of you if you can't save enough is not really workable, particularly as more people are aging. So we've got to come up with better long-term care.
What strategies do you think have worked or not worked based on what you've seen in various countries?
Yeah, a lot of my research is based out of the Netherlands, so I've gone and looked at innovations in long-term care there. I think there's a number of things that are working. I think in the Netherlands they have apartments for life, where they try to keep people who are aging in the same apartment and change the apartment and keep the apartment in a place where they're still connected to their neighborhood and the social networks and the resources that keep them happy, healthy, and whole. In the U.S., we have a bunch of different versions of assisted living, and then we have a growing shift to having more innovations to help keep people in the home and in the community. And I think that's kind of where we're heading now, definitely in the U.S. and I think around the world as well.
A lot of countries have increased the retirement age. A lot of people are just assuming that they're just going to have to work past what they thought would be the retirement age into their 70s, even 80s. What impact do you think that issue will have?
Well, you know, my perspective on that comes from anthropology, because I know that sitting with people who, as they are aging and approaching end of life, what is most important, what keeps people whole and connected, are actually their social networks. And so it's funny that in work, this is largely where many of us come to grow our self-identities and get our self-worth and to connect with other people and be able to have reciprocating relationships. And so actually, I think by increasing the retirement age, you may have an impact that allows people to stay connected longer and actually live, you know, happier and healthier lives. So I think we got to get better with the work-life balance as we all get older, but increasing the retirement age could have some benefits.
So it's really changing your way of thinking because working brings you community, right? It brings you a person's community.
And community keeps you connected, and it keeps you living a life that is something that usually gives you the things that you need to sustain.
And what about for the families caring for this aging population? Parents who have to look out after their children and their parents, we're seeing more of that as well. How can they deal with this, some of the challenges associated with that?
Yeah, I think everyone needs to, we need better long-term care, and we need to plan better for it. The caregivers tend to get, particularly in our country, get very stretched, very thin, because, you know, we give and we take care of our parents as long as we can, and then when we can't anymore, then we don't have a lot of options after that. So I think the best way that we can help both the caregivers and our families is to focus on what kind of supports can we bring. People want to stay in home, so how can we keep them at home as long as they're able to do that? And how can we keep them connected to the social resources that they have in the community and to the resources that they can get through their families and in their neighborhoods?
All right, Frances Norwood, thank you so much for your time and your perspective.
Thanks for having me. I appreciate it.